The testbed environment creates an opportunity to really work with exciting companies, to be able to rapidly test whether or not the solutions they provide or suggest are meaningful and useful, and then be able to iterate, and then to be able to look across the span of what industry offers and be able to pick out those that we think are going to be useful and then test them rapidly.
For us to prove the value of the technology we're inventing, we need to work with clinical colleagues. We need to trial things before we know they really work. Hence the requirement for something like a testbed environment.
It gives you access not only to the clinicians but also to all the resources that sit behind those clinicians, such as information governance and e-health, and really it gives you the best opportunity to actually deliver sustainable change within the health service.
The triple helix of academic, industry and healthcare partnership is the only approach by which we're going to improve and address the healthcare challenges that we face. I've not seen clinical trial practice move so fast from results to implementation to getting something new effective in patients' hands, really by any other approach.
And what we've seen with the companies who started to work with right back at the start of the test beds, that they've actually scaled their companies quite significantly. And that's a response to areas of need within the NHS and then being able to provide solutions for that. So critically for those companies, it's not just about employing more people, but it's actually about being able to start to access markets out of Scotland.
This year, in fact, we're the biggest we've ever been as a company here in Edinburgh. That's fantastically exciting, and in no small part thanks to this project and the work associated with it.
COPD, chronic obstructive pulmonary disease, is a global healthcare challenge. It's the second commonest cause of hospital admission in Scotland, and it's projected to be the leading cause of mortality worldwide by 2030. Over the first year of the Dynamic project, we'd developed the digital innovations, including patient application and clinician application to support COPD management. The partnership between the West of Scotland Innovation Team and Storm ID has reaped benefits which have impacted positively on clinical outcomes and patient care.
What Storm brought to the COPD project was our service design skills and our agile software development practices, along with the Linus Health platform that allows patient-generated health data from devices and sensors to be shared back with clinical teams in real time.
As part of our response to the COVID challenges to try and maintain and bolster COPD care during the COVID lockdown with COPD patient shielding requirements, we rapidly reorientated and upskilled the Dynamic project.
The app takes what is normally a paper form, and a clinician would fill out clinical details of an assessment, and it digitizes that.
SBAR, so Situation Background Assessment Recommendations, is a structured communication tool that's used in a lot of clinical settings. And for the purpose of this, we added a C for COVID into that, so it became SBCAR. And what the app gives is a consistent way of approaching a patient, a structured data recording tool, but actually it's just enabling them to have confidence about the questions they ask, and the data that they're recording will actually influence that patient's care.
We then take the individual patient's data and we output it as a PDF into the patient record, which is shared across the hospital. And then their data joins a bigger picture that helps us to understand what this virus is doing.
The COVID-19 app started being piloted in the first emergency department, which is here in the Queen Elizabeth. It has been a tremendous boost, I think, to our staff, seeing an innovation right in the middle of a global pandemic, which is improving patient care and excellence in recording. It's been a massive uptake by our junior doctors, by our nurses, our consultant staff alike, and across into the acute specialties, into medicine as well.
And we're now in the process of inviting other boards and other hospitals who want to adopt the same technology to get in touch with us, and we'll work with them to roll it out for them.
focus of the project is around a virtual consultation platform where patients upload images and details about the condition, and the healthcare professional can access that at a suitable time within the working week and then return that information, a result, back to the patient.
It's a more efficient way of delivering outpatient appointments, and from a patient point of view, it's a far more convenient way of interacting. There is no need to travel, there's no need to take time off work, as the patient can answer their questions at a time and place that suits them.
Our initial assessment of the viability of this system was over 50 patients over a 3-month period, and this was largely return patients. With the onset of the pandemic, we've seen a 10-fold increase of use to over 500 patients being assessed. We're operating clinics that are 50% digital, 50% face-to-face as being our standard clinic template for all clinics moving forward in our service. So we've really pulled forward the transformation of our service very rapidly.
The advantage of the test beds is that it gives you access to test the product in a real-world environment, and that ultimately helped us learn what worked and iterate the product over a number of months.
We've been able to deliver, with the help of the test bed, a digital platform that is fit for purpose for use within the NHS in the UK in one specific specialty, but where the flexibility of it is that I foresee that it could be used across multiple specialties and therefore have considerable gain for patients and for the health service itself.
vCreate is an asynchronous clinical video service which allows patients and clinicians to communicate with each other directly over video. It's a two-way tool used within neurology to enable patient families to send in videos of their relative's condition so they can be assessed directly by their clinical team and stored within the electronic patient record. We worked with the West of Scotland Innovation Team and local service clinicians to further develop an existing service to fit their particular clinical requirement. Within paediatrics, the tool has had an incredible impact, with over 60,000 videos sent to more than 13,000 families since its inception. More recently, within neurology, the pilot has seen over 560 families send in over 1,300 videos directly to their clinical teams, resulting in a significant reduction in investigations and clinical outpatient appointments.
My name is Dr. Gerald Lipp. I'm the Director of Breast Screening in the North East of Scotland. iCAD is an innovative UK-funded Centre of Excellence based in Aberdeen and Glasgow, and we do AI research.
What we're applying is artificial intelligence to the specific problem of how to automate some of what a radiologist or a pathologist would do when they look at images of people who've got a disease, or maybe they haven't got the disease, and decide what happens next for that patient. There's a chance now to really apply new technology in a way that's never been done before, prove it rapidly, and have a dramatic impact on people's healthcare for the future. That's the opportunity. If we can do that well in Scotland, it's all about early access. It's all about proving that it works clinically and financially and operationally. And if we can do that here in Scotland, the opportunities for companies like us here in Scotland is really significant.